it was out there, the research and the evidence, and there wasn't much around. So when the government were looking at ways that they could forward integration, and that was the main agenda, was how do we integrate all our professional groups together? But let's focus on families and bringing our looked after children numbers down, which are, as you know, extremely high in Wales. They looked for the research and found option 2. So they came to me and they said, can this be the basis of the integrated model? Yes, it definitely can. We have evidence of what works. So then we set about thinking about what that structure looked like, who the professional people would be involved, how they would relate to their own pathways into their own professions, and how they would function. So then you had a CPN, you had a drug and alcohol specialist, you had a social worker, you had a group of professionals, OTs, health visitors, and they formed one team. And then when the referrals came in, that team would look at that referral, and one person out of the team would go out because they're all doing the same thing.
Yeah.
They brought their specialist knowledge to bear in their reflective groups. So that was really helpful conversations to have your colleagues there. But not
for the family. The family just needed one person.
Just one person with the backing of all that expertise behind them, which was just so different from most of the integrated team models, because most of the integrated teams were identifying individual siloed specialisms. And then someone would have lots of people working with them potentially.
Yeah, and the integration would often be no more than communication and or maybe data or pathways or paper processes. It wasn't actually what the individual families were experiencing, of course.
Exactly. So the impact wasn't any different in the community just by putting a lot of professionals together in one space. And, you know, we've seen multidisciplinary teams that are in the same setting continue the very rigid siloed work with very different philosophies. Some that are not in the same area necessarily, but because they've got a value base and a principle base and a skill base that they share, they're more successful.
I came across the worst example of this the other day. We went to meet with someone in the office, and it was like, can you tell me who so-and-so is? They work in the same multidisciplinary shared hub as you. And they didn't know.
They didn't know. Yeah.
Like, they were emailing them across the floor space. Anyway, go on, carry on.
No, but that's integration in name only is the problem. And, you know, what we had in the IFSS was true integration.